All right, welcome back. Hope you're having a great week. Today we're continuing our review of our fourth BCBA exam. We're going to the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please check out behavioranalyststudy.com. We offer 3 practice exams, our task list study guide, and of course, our combo pack. As always, questions, comments, let us know. Work hard, study hard. Let's get to our questions. 71. A college professor is teaching an advanced mathematics course in the spring. On the first day of class, he gives an ungraded quiz to everyone in the class. Once they are finished, he quickly grades the quiz and gives them back to the students to take home and review. The professor is most likely looking for what kind of data? Measurement procedure question. What kind of data is the professor looking to obtain? Now, there's a few different pieces to this that you're going to have to consider. First, it's the very first day of class, and it's an ungraded quiz. So immediately, you should start thinking this is probably prior to intervention. It might be a probe. It might be a baseline. We want to see where the students are starting before we begin actually teaching. Additionally, once they are finished, he grades the quiz and gives them back. That should signal to you he's not collecting this permanent product, right? He's not collecting these quizzes to take home and keep. He is giving them back. So, first day of class, ungraded quiz, looking to establish some sort of probe or baseline. He's also giving them back. He's not keeping them as permanent product. So what kind of data is he looking for? A, permanent product. Again, this section, once they are finished, he grades the quiz and gives them back to take home and review, indicates he's not really interested in the permanent product. It's not graded, right? So he's going to grade them, give them a grade, but it doesn't count. And then they take home the test. So he's not keeping any of these items. So he's not really collecting the permanent product for himself. B, baseline. Yes, right? First day of class, ungraded. He's looking to figure out, where are we starting? Where are we beginning? Before I start teaching, before my intervention, where are these students currently? C, indirect. Well, he's directly taking data on their behavior, on the students, right? So it's not indirect. And then event recording is essentially frequency, right? How many times something is occurring. He's not taking any sort of event recording data. What he's doing is he's trying to establish a baseline for where these students are beginning before he's actually starting to teach advanced mathematics. After 2 months of intervention, a client's dad tells you that he has seen no change in the client's behavior. When you check the data indicate a significant decrease in behavior. How should you proceed? This can happen pretty frequently, and that's why we don't trust and go off of anecdotes, because anecdotes just are faulty, right? In this case, we need to figure out what is our next step. We've been 2 months of intervention. The client's dad tells you there's no change. So he's seen no change in the behavior. However, the data indicate a significant decrease. Which one are we going to believe? And it's not we don't believe the client's dad that he doesn't see a change. It's just the data says there's been a significant decrease, and we have to trust our data. Or what else could we do? A, change the intervention at the request of the client's dad. We just can't do that. If we changed our intervention at every single request, we'd constantly be updating things. The data so far looks good. Now we need to check things like fidelity, including treatment drift, observer drift, all of these things to make sure that data is valid, reliable, and accurate. But as of right now, it seems like the intervention is working. B, directly check for treatment fidelity. We have to do this, okay? If the client's data is saying, I don't see a change, and the data is telling you something drastically different, you need to go ahead and check for treatment fidelity. You have to make sure your technicians are taking data correctly. C, ignore the dad's feedback since the data is good. We don't want to ignore it. We need to walk the dad through the data, explain to him why we use data, and then go in and further investigate why is there a discrepancy. D, sit down with the technicians and ask how things are going. Okay, maybe a decent idea, but this is very indirect. You're not actually watching them take data, measure anything, implement anything. A much better check would be to go in and directly look at the fidelity of their treatment and their data collection. So how should you proceed? Well, check for treatment fidelity. How is our data collection going? Is it accurate? Are you measuring the right thing? Are you treating the right thing? And this way, if our fidelity is good, they're measuring and treating the right behavior, then we can just explain to the dad that the intervention seems to be working and we have to continue as we decrease it. And if in the future it still isn't changing his perception, all right, maybe you could take a different route. But the first thing you need to do is just make sure your data is accurate, reliable, and valid, and that the treatment is going well. 73. How long must pass before you, a licensed and practicing BCBA, are allowed to date a client or stakeholder? This is kind of a fluency check. It's straight from the ethical code. It's just a number you need to know. All right. You need to know how long can pass before you can supervise someone you've dated. And then you need to know how long can pass, how long has to pass before you can date a client or stakeholder. So 6 months, 1 year, 2 years, or 5 years. 6 months is going to be how long you have to wait until you can supervise someone you previously dated. 1 year is not applicable here. 2 years is how long you must wait to date a client or stakeholder. So if you're a licensed and practicing BCBA, you have to wait 2 years before you're dating a client or stakeholder. Sometimes you just have to have fluency checks, right? Sometimes there are just things you can't apply, you can't figure out. It's just kind of rote knowledge. This is one of those things. So as long as you're aware of these numbers, you'll be okay in questions like this. 74. If you're using a contingent tangible condition during a functional analysis, what is the proper way to implement the procedure? On first glance, it might seem like a challenging question, but we just have to break it down and go slow and realize it's not overly complicated. So what are we asking about? We're asking about the proper way to implement a functional analysis, in particular, a contingent tangible condition. So if we're contingent tangible, that's our condition. What does that mean in a functional analysis? Well, it means we're testing for the function of obtaining a tangible, meaning when the behavior occurs, right, we're going to remove an item. I should say we're going to remove an item every now and then. And if the behavior occurs, and we're going to give it back, right? So we're going to occasionally remove the preferred tangible, see if we can evoke the problem behavior, and then we can try to give it back and try to make a hypothesis that the tangible condition represents the function of the behavior. So if we're going to do that, what is the proper way to do that? A, give access to only the preferred tangible, remove the preferred tangible occasionally. So the second part is right. Occasionally, you are going to remove the preferred tangible. But we don't only give access to just that preferred tangible. Remember, in a functional analysis, you're in a very controlled environment and room. The only things in that room are what you put there. B, give access to only the preferred tangible and adult attention. Remove the preferred tangible occasionally. Yeah, we're getting closer, but it's still not quite enough. Remember, it's a tangible condition. We're looking at the preferred tangible, right, and taking away the preferred tangible. But what we're going to give access to is the preferred tangible, the adult attention, and neutral or moderately preferred toys, right? So there's other options around. There's other things around. We're really trying to investigate this tangible condition, right? Is removal and access to this preferred tangible, to this tangible, really what's setting off that behavior? D, give access to only the preferred tangible. Remove the tangible when the target behavior is observed. Nope. What we're going to do is C. We're going to give access to only the preferred tangible, adult attention, and neutral or moderately preferred toys. And then we're going to remove the preferred tangible occasionally. This is going to be our functional analysis to try and determine if obtaining a tangible is the function. 75. As far as control is concerned, what part of a functional behavior assessment will demonstrate the least control? There's our key word, least. Now, with control, prediction, description, control says we have power over the behavior. Our independent variables are affecting the behavior. We have experimental control, we have functional control, however you want to say it, we have control. What part of the functional behavior assessment is going to demonstrate the least control? The least indication that we actually control the behavior. A, an indirect assessment. Well, of course. And why? Because with an indirect assessment, we're not actually observing the behavior. How can we determine if we have control or not if we're not actually watching the behavior occur. With the direct assessment and a functional analysis, we are actually observing the behavior. Maybe in a direct assessment, we aren't manipulating things, but at least we can see what's happening, right? With the functional analysis, now we're really demonstrating control because we're actually manipulating antecedents and consequences. Go back to our previous question, manipulating the tangible condition. So, which part of the functional behavior assessment is going to demonstrate the least control? Well, it's going to be an indirect assessment if you're not actually observing the behavior occur. 76. A 2-year-old is starting to speak in sentences like water, please. The primary reinforcer used is obtaining the tangible. Yesterday, the client took his sister's water and drank it. Now, the client is not asking for water, but is instead trying to steal other people's water. What occurred? Break it down, kind of a long question. We're asking about what occurred relative to this client's behavior. And what happened? Well, the client is no longer asking for water, but is instead trying to steal other people's water. And why? Well, we look up here, they were starting to speak in sentences, right? The primary reinforcer for obtaining intangible. But now the client took his sister's water and drank it, meaning the client was able to obtain the tangible, the water, without actually having to speak. So that functional behavior got reinforced instead of the sentences. And as we know, we can inadvertently reinforce problem behaviors, but whatever behaviors are reinforced are going to persist, whether we like it or not, right? So what occurred? A, the client's behavior was reinforced by his sister's attention. Did the client's behavior occur for attention? No, the behavior occurred to obtain the tangible, the water. B, gaining the water reinforced a functionally equivalent behavior. Yes, the behavior we want is speaking in sentences. The behavior that got reinforced was stealing the water. Both behaviors grant access to the water, but the wrong behavior was reinforced, okay, because it still obtained the behavior, and that can happen. So gaining the water reinforced a functionally equivalent behavior to speaking in sentences. C, the 2-year-old's behavior regressed. Well, no, we're not going to say that. There's really no indication of that. And then D, the parents inadvertently punished the 2-year-old's communication. Again, no indication of that. You're only using the information given. Nothing indicates punishment took place. Nothing indicates regression took place. What most likely happened is a different behavior was reinforced. A functionally equivalent behavior was reinforced. 77, tell a client to grab their blue shirt and then point at the blue shirt. This is considered a what? When you see these words cue, we never jump to the answer choices, but I just want to make a point here. When you see the word cue, just think prompt. Okay, replace cue with prompt, and these questions become a lot easier. So we tell a client to grab the blue shirt and then point at the blue shirt. So this is our prompt, right? Pointing at the blue shirt. So what kind of cue, aka prompt, is this? Is it a positional cue, a stimulus cue, a physical cue, or a movement cue? What isn't a positional cue or prompt? Because we're not moving the shirt around, right? We're not changing the location of the shirt. It's not a stimulus cue or prompt because we're not altering anything about the shirt. Now, be careful here. Physical cue and movement cue can sound a little confusing. But if you change it to physical prompt and movement prompt, well, you know this isn't a physical prompt, right? We're not physically prompting them to do anything. What we're using is a movement cue. We're indicating by pointing at the shirt. So telling the client to grab the blue shirt and then pointing at the shirt, the pointing is the movement cue or the movement prompt. 78, after weeks of preference assessments, you, a BCBA, have finally found an item that is reinforcing for your client. Nothing else seems to work quite as well. What can you do to decrease the chances of satiation? Okay, the key word here is satiation. Satiation is a type of motivating operation. You've had too much of something, right? And now the value has decreased. And that can happen with reinforcers, especially in this case, where after weeks of preference assessments, you find one item that is reinforcing for your client. You definitely run the risk of satiating that client on that item. So what do we need to do? What can we do to decrease the chances of satiation occurring? A, ask the parents, do not give the item outside of therapy. Absolutely. The less he gets it, the better. B, increase the response requirement to gain access to the item. Again, the less he gets it, the better. If it's harder to gain and he's getting it less, the chances of satiation drop dramatically. C, pair the item with other items. And this is what we really need to be doing, right? We finally found something with reinforcing properties. We need to go through the steps and procedures to pair that item with other items. All three of these things are going to go a long way in decreasing the chances of satiation. So, what can you do to decrease the chances of satiation? Well, limit how much he gets it, make it harder to get, and then pair it with other items so you can use other items. So, what can you do? Well, D, all the above. So, number 9, James has type 1 diabetes and uses the bathroom frequently. However, James takes advantage of this and will often go to the bathroom several times per class. If we wanted to target James as asking to go to the bathroom for decrease, what will be the best differential reinforcement procedure to use? So you got to be careful here, right? We want to decrease this behavior, but we're not teaching a replacement behavior, and we're not eliminating this behavior. He still is going to have to use the bathroom, right? That's just the case, right? He's got type 1 diabetes. He's got to use the bathroom frequently. The problem, he's just going too often, right? He's going too much. So what we want to do is decrease it without eliminating it. How are we going to do that? A, DRI, differential reinforcement of incompatible behaviors. Well, we're not trying to get rid of him going to the bathroom. He needs to go to the bathroom. We just need him to do it less. B, DRO. DRO would be in the absence of going to the behavior we're going to reinforce. Again, not trying to eliminate it, right? So what we're going to try to do is use a DRL procedure, differential reinforcement of lower rates. We're not getting rid of it. We just need to lower the rate to a more appropriate amount. A DRD, remember, is pretty much just like DRL, except with the DRD, we're aiming to get rid of it entirely. So if we wanted to get James to continue going to the bathroom just a lot less frequently, the best procedure is going to be DRL. A teacher instructs her paraprofessional to take play check data on a group of students. The paraprofessional says they've recorded 8 instances of behavior. Based on the chart below, what went wrong? Okay, we're looking at the chart here. This is a chart question. What do we know about this situation? We know the paraprofessional was supposed to take play check data, planned activity check. It's a type of momentary time sampling, right? So they took 8 instances of behavior. Based on the chart, we know we have a 20-second interval. And so if we're using play check, we're going to be looking at the behavior at 20 seconds each time, right? At the end of each interval. Now, the paraprofessional says they recorded 8 instances of behavior. What's the problem here? We have 20-second intervals. We're checking for behavior at 20 seconds, at 40 seconds, at 60 seconds. Did the behavior ever last 20 seconds? Or did it ever occur? Did the behavior ever occur at 20 seconds? Remember, this is just momentary time sampling. So it needs to occur at 20 seconds. And based on this data, okay, there's no indication this behavior occurred at 20 seconds. In fact, it looks like they've taken the data completely wrong, right? During a play check, you're not recording how long the behavior is occurring, okay? The only thing you're doing is just like a momentary time sampling question. You're looking at the end of the interval. And so the paraprofessional just took the data completely wrong. So A, the paraprofessional used momentary time sampling instead. No, it's not. They didn't, right? Because play check is momentary time sampling. So if they actually recorded 8 responses, what they did instead was used partial interval, right? Because if they have 20-second intervals, the behavior just has to occur at any period or any point in time. And that's what they put, okay? The behavior, this is when it happened. This is how long it happened. I have 8 responses. Whole interval, it would need to occur for 20 seconds. So if they somehow got 8 responses, then they accidentally used partial interval recording instead. Great. Thanks for watching. Please check out behavioranalyststudy.com for our study materials. Like, subscribe, comment, questions, let us know. Work hard, study hard. See you soon.